Welcome to our discussion summarizing the accomplishments of the Mississippi REACH program. The Mississippi Public Health Institute, or MSPHI, secured funding from CDC's Positive Change in Community Health. Mississippi REACH stands for Racial and Ethnic Approaches to Community Health, prioritizing the health of African American women of childbearing age along the Mississippi Gulf Coast. The project was funded from 2018 to 2023 with a key focus on breastfeeding promotion among African American women living in Hancock, Harrison, and Jackson counties. REACH implemented a range of initiatives, some of which aimed to improve healthy food access and offer breastfeeding support for Gulf Coast residents and families. It is MSPHI's hope that the efforts, initiated through REACH, spark longer-term, community-led interest in improving healthy food access for breastfeeding for African American families. In fact, MSPHI was recently awarded another round of REACH funding to realize this long-term vision. Along with food access, various efforts have been undertaken to promote breastfeeding among groups for which this practice is less common, primarily African American mothers of childbearing age. Collaborating with the Mississippi State University Social Science Research Center, our team designed a telephone-based survey where we contacted both African American and white Mississippians living in the Gulf Coast region. Their insights on healthy food access were crucial in shaping REACH's community health strategies. A representative sample of adults aged 18 and older were carefully selected for the 3 REACH counties. Using a random digit dialing method, we used both landline and cellular phone numbers to collect data from our catchment area. A non-random sample of African Americans was also conducted separately to ensure robust insights and valid findings. Data was collected on food access, household tobacco use, and breastfeeding. For this discussion, we'll focus on food access and then pivot into breastfeeding. The first wave of the social climate survey was conducted in 2019, while the second follow-up wave was conducted in 2023. In what follows, we compare results across the 2 survey waves for African American and white respondents. When asked why most respondents buy food from their store of choice, differences by race could be seen for the "it's near public transportation" response, with more black respondents saying that this was a relevant factor when compared to whites. Similarly, more blacks than whites indicated that they selected stores based on who accepts SNAP, food stamps, or WIC. Next, we asked respondents what keeps them from getting the fruits and vegetables that they want. Once again, zeroing into the figures that show differences by race, we can see that blacks in 2019 noted that the price of items and unavailability were both limiting factors, though these disparities balanced out in 2023. We further inquired about survey respondents' relationship to fruits and vegetables when we asked how often they consume these healthy foods. Generally speaking, in 2019, respondents consumed fruits and vegetables at a similar frequency regardless of race, whereas in 2023, whites generally consumed fruits and vegetables more often. Focusing on those who consumed fruits and vegetables 2 to 4 times per day illustrates this pattern. The racial disparity in this response nearly doubled from 6% in 2019 to 11% in 2023, with considerably more whites eating these healthy foods. Current efforts continue to address this healthy food consumption disparity. Next, we asked respondents a series of knowledge and perception questions about breastfeeding. In the graphs, the correct responses for knowledge questions are highlighted in green. For most knowledge questions, there were only slight changes from 2019 to 2023. We do observe some beneficial changes in the percentages of African American responses who strongly agree that breast milk is more easily digested than formula, and also that breast milk is less expensive than formula as well. Both of these answers are the most desirable and correct response. One other positive finding concerned the perceptions that women should not breastfeed in public places, such as restaurants. African American respondents are much less inclined to disagree with the statement in 2023 than in 2019. We then asked several questions about different forms of community support for breastfeeding. In both 2019 and 2023, blacks were more likely to indicate that employers and work sites were very unsupportive of breastfeeding mothers. The same pattern continued for perceptions of physician and faith community support for breastfeeding. Overall, whites experienced much more community support for breastfeeding. We then asked a series of knowledge questions concerning breastfeeding. Black and white respondents generally showed similar awareness of correct responses. Across both races, however, it appeared that there are knowledge gaps that could be filled through greater levels of education and programming. After this last round of knowledge questions, we asked how the 2022 baby formula shortage had affected respondents' support for breastfeeding. While whites overwhelmingly marked that there were no changes in their support for breastfeeding, desirably, blacks indicated that they had become much more supportive of breastfeeding since the shortage. We then asked about the degree of comfort respondents had in different breastfeeding situations, such as breastfeeding around friends and acquaintances. Generally speaking, blacks were less comfortable with breastfeeding in these situations when compared to whites. Next, we asked about thoughts on and participation in breastfeeding support groups. Relatively equal numbers of whites and blacks selected similar responses, so no substantial racial differences emerged concerning breastfeeding support groups. Finally, we asked respondents about where they have observed breastfeeding promotional material. Generally, Additionally, blacks were more likely to see breastfeeding material on social media, online but not social media, and at doctors' offices or healthcare centers when compared to whites. Along with the great findings that have already been generated, REACH has been renewed for another 5 years in an effort to gain even more insight on communities along the Mississippi Gulf Coast. Not only will this mean that more education can be given to those in need, but also to a more expansive region, as the Mississippi REACH catchment area has been broadened from 3 counties to 6. With resources like this in the pipeline, there's no doubt that Mississippi will be able to continue to improve its current standing for health outcomes among African American families.